Mr. Goddard.
Hello.
How are you today?
Good, you?
Good. My name is Lauren, and I'm going to be your nurse today. We're just going to do a head-to-toe assessment. So I'm just going to do some inspection, some palpation, and also some auscultation today, okay?
Okay.
Okay. We're going to start with your head and your hair and your scalp, and your head and your neck. Okay, so I'm just going to look at your hair. I'm just going to get you to turn to the side. Okay, the other side. So your hair looks healthy, shiny, normal, what I would expect. I'm just going to palpate your scalp, okay? So I noticed that your skull has no indents, no lumps, also no lesions or any abnormalities on your scalp. And was there any tenderness when I did that?
No.
Okay. I'm just going to palpate you for your lymph nodes now. So I'm just going to expect that there's no lumps, there's nothing abnormal. So they're all movable. Occipital. And there's no tenderness when I do this. Can you just shrug up for me? Okay, I'm just going to palpate in your collarbones. Awesome. Okay, so now I'm just going to take your pulse on your carotid. Okay. I expect that the pulses are going to match, and they do feel strong and within a normal range. I'm just going to auscultate with my valve. Okay. Okay, and I hear no bruise, which is expected. Okay. Now I'm just gonna palpate for your thyroid, okay? So I'm gonna come behind you. I'm just gonna get you to look down and to the other side a bit. Okay, and I just want you to swallow. Okay, can you look to the other side? Swallow. Awesome. So there's no lumps, it felt movable and consistent in texture. Okay, so I'm just going to do some range of motion with you. I just want you to look all the way down, chin to your chest. I want you to look all the way up, okay, and then back towards me. Okay, over your shoulder. And to the other shoulder. Okay, and there's no tenderness there, no tightness? Okay. I'm just going to press down on your shoulders, and I want you to shrug up. Okay, and that felt strong. And then I'm going to get you to do some I'm just going to get you to press your cheek against my hand on this side. Okay. I'm also just going to inspect and notice that your face is symmetrical. There's nothing wrong with your skin. It looks consistent in color within normal range. Okay, I'm just going to get you to do some facial expressions. Can you smile, frown, wrinkle your forehead, and puff out your cheeks? Awesome. Okay, I'm just going to palpate your nose now. So there's no pain when I do this. Okay, so I notice that the septum is not deviated. And then while I'm doing this, I'm just going to move on to your maxillary and then your frontal. And is there any pain or tenderness when I do that? Okay, I'm just going to percuss. So and was there any pain when I did that? Okay. So now I'm just going to feel for your jaw joint, and I just want you to open your mouth and close. And again. Okay, and I felt no crackling, so that's within expected range. Okay, I'm just going to use my pen light and inspect inside your mouth. Okay. So can you just open up for me? Okay. And I notice that the gums look healthy, the teeth look well kept. The tongue is pink in color, there's no inconsistencies. Can you say ah?
Ah.
Okay, and I'm just going to note that the uvula goes up and down, and also that the tonsils are within the columns, so that is within expected parameters. I would rate that a 1. Okay. I'm just gonna get you to do a little reflex for me. So can you open again? And I want you to push your tongue towards the stick. Okay, and the other side. Awesome. Okay, so we're gonna move on to your eyes and your ears, which is our next system. So I'm just gonna get you to look at the pen light, okay? And I don't want you to move your head. So I want you to keep your chin exactly where it is, okay? So I'm just doing the 6 cardinal. And I notice that he's moving his eyes smoothly and in the direction I'm going. Okay? Now we're just gonna do the cover uncover test. So I'm gonna cover this eye. Okay, so I notice no lagging or weakness in that eye when I uncover it. Okay, this eye. Okay, perfect. Now we're just gonna do the corneal light reflex. So I'm just gonna shine my pen light in between the bridge of your nose. And I notice that the light reflect is in the same spot in both eyes. So that is a normal finding. Okay. At this point, I would assess the lacrimal apparatus. I would don gloves and press on the lacrimal apparatus. I would expect no drainage. If I did, that would be an abnormal finding. So now I'm just going to inspect your pupils. So I want to make sure they're round, equal, accommodating. So our first thing is going to be, I'm just going to inspect. So I noticed that his pupils are a normal size. They're not overly dilated or overly constricted. And also that they are both the same size and that they are round. Okay, so we're gonna start our first test. So I'm first gonna shine directly in your light, the light into your eye. So I just want you to look into the distance, okay? So just focus on an object. Okay, so I was just assessing his eye to make sure that it accommodated with the light. And now I'm just gonna check his other eye to see if the other eye has the same reaction, which it does. So now I'm just gonna do your other eye. Okay, and now I'm looking at your opposite eye to check if it's accommodating and consensual. Okay, and it is. Now I'm just gonna get you to focus on my pen light, and now I want you to look in the distance. Okay, on my pen light and into the distance. Okay, and his eyes are accommodating for the distance as well. So that was all within normal findings. Okay, so at this point, I would take my ophthalmoscope and check for red reflex. I would expect a red reflex in both of the retinas. Okay, so now we're gonna move on to your ears. So looking at your outer ears, they look normal. The color is consistent with your face. There's no abnormal findings. The line between your eyes, the eyes and the top of the ears are equal on both sides, just while inspecting. At this point, I would do the Weber and Rhine test. I don't have a tuning fork with me at this time, but for the Weber test, I would hit the tuning fork and place it on top of the head. I would expect that he would hear in both ears equally. For the Rhine test, I would put a sound onto my tuning fork, put it on the bony prominence behind the ear, and then he would tell me when he stops hearing the noise, which I would then move to the outer ear, and he would tell me when he stops hearing the noise. And I would expect that air conduction would be twice as long as bone conduction. So then we're just gonna take our ophthalmoscope again, and I would pull his ear back and down, and then assess the tympanic membrane. I would expect a pearly gray color. I would expect the cone of light at 5 in the left ear and 7 in the right ear. Okay, so now I'm just gonna ask you to swing your legs around, and so you will sit off the chair like that. Okay, so now we're just gonna assess the back thoracic area. So I'm just gonna feel, and I feel no lumps, no lesions. So we're just gonna do thoracic expansion. So can you just take a deep breath for me? Okay, and let it out. So I noticed upon inspection that both are rising the same. So I'm just gonna feel and just take another deep breath. Okay, and that was normal as well. So now I'm just gonna palpate down the spine and you tell me if there's any tenderness, okay? So I noticed that it is midline, and was there any tenderness? Okay. Okay, so now I'm just going to percuss and auscultate. So first I'm going to percuss. So I'm checking for my 9 places, and I'm just comparing from side to side. Okay, 8, 9. And I heard some resonance, which is expected. So now I'm just going to auscultate in the same fashion. Okay, and can you take a breath for me? Again. 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 Okay, and I'm just going to note that I heard no adventitious sounds and that the breathing was equally distributed. Now we're going to move to the bed so I can put him back at a 45-degree angle for the anterior thorax and for the abdominal area and the lower extremities. Client sitting at a 45-degree angle so I can do the anterior chest exam. First thing I'm going to do is inspect. So I'm going to inspect for first the skin. I see no bumps. Is there any lesions, tenderness on your skin on your anterior thorax? No. I'm also just going to notice there's no abnormal bony prominences. Everything looks symmetrical. As far as muscle tone, the shoulders look well toned. So does the anterior thorax. So everything would be normal within expected findings there. Second thing I'm going to do is I'm going to palpate the aortic pulse. So I'm just going to palpate landmark 2 down, palpate, and I feel a strong pulse there. So now I'm going to percuss for the lungs. So I'm just going to percuss the landmark, and I'm just going back and forth. I'm going to go side. Okay, and I hear resonance throughout, so that's within normal findings. So now I'm just going to auscultate. So first I'm going to auscultate for breathing sounds in the lungs. So I'm just going to get you to breathe when I say, and I'm going to compare side to side. So go ahead. So now I'm going to auscultate for the heart sounds. So I'm just going to landmark my 5 spots. So first I'm going to go to the side, and I'm going to landmark 2 intercostal spaces down. So right about there. Okay, and then I'm just going to go right across. You can line that 2 down again. Okay, I'm going to go to my third spot. I'm going to go down to my 5th intercostal space around here towards the sternum. And then I'm just going to finally do my apical. Okay. And come on.
Yes.
Yes! Oh my gosh. Okay.
Did she just ruin the whole thing?
No.
Okay.
I'm just going to pretend I'm from here. Finally, I'm just going to do my apical.
You already did that.
What did you just say?
Okay. Sorry.
This is apical. Okay. I'm finally just going to do my apical. Okay. And I noted that my S1 got louder as I moved down, which is normal findings, so there's no worries there. So now I'm going to move my patient to a lying down position to do the abdominal and lower extremity. Now that I have the patient in a lying down position, I'm going to move on to the abdomen and inspecting the abdominal system. So I'm just going to get the patient to raise their shirt. So I'm inspecting the abdomen, and I'm just going to go to eye level, and I'm going to take note that it's flat, so it's not protuberant or concave. Also that the skin is even in tone, that the abdominal muscles are symmetrical and there is tone. There's no lesions, no bruising, so that's all normal findings. So I'm going to start with auscultation this time. I'm expecting vowel sounds in all 4 quadrants, so I'm going to start on the lower right. So as soon as I hear a sound, I'm just going to move to the next one. Okay. Okay. And I hear that all quadrants are active. I'm also just going to check for any aortic pulses if I can see one. So I'm just going to get you to take a brief breath in and then out, and just hold your breath. Okay, and I do see a small aortic pulse at the top there, so you can breathe again. Okay, so now I'm going to palpate. I'm expecting tympany in all 4 quadrants, and I'm just going to do zigzag motion up the midlines of the clavicles. So okay, and I noticed that I don't hear tympany in that part. That would be expected because that is where I expect the liver to be. I'm just going to move to the other side. Okay. Now I'm just going to lightly palpate, no deep nothing deep. So I'm just going to follow the same zigzag from the right lower quadrant. So just tell me if there's any tenderness or pain. Okay. Okay, and it all felt good and smooth. So you can take your shirt back down. That's good. So I just got my patient to change into shorts so I can examine the lower extremities better. So first I'm going to inspect. So I'm noticing that skin tone is even and bilateral. I'm noticing there's no viscosities, there's no lesions, no ecchymosis, no abnormal discoloring. I'm just going to do the same for the feet. So the same. There's no bruising, lesions. Okay, I'm just gonna get you to raise your leg. Check under. Okay, nothing under there. Nothing under there. Nothing on the heels. So now I'm just gonna inspect for edema. Doesn't appear to be any. Also hair growth looks equal, bilateral, normal. So now I'm just gonna palpate for edema, and I feel none. So that's good. And then I'm just going to check temperature. So going down, feels the same. Okay, and it feels warm, normal, not too hot. So now I'm just gonna check my pulses. So check this one. I feel it and it's strong. And I'm gonna check this. It's strong as well. So then I'm just gonna compare it to this side. Okay. And both pulses on both feet feel the same, and they both feel good, so normal findings. Okay, so now I'm just gonna inspect muscle tone. So first, just looking at it, both legs look equal in muscle tone. They look well toned. So first thing I'm gonna do is I'm gonna get my patient to press up. So press up. Press up. Okay. I'm just gonna get you to roll to your side. So to this side first. Okay. And I'm just gonna get you to try to raise your leg while I push down. Okay. This feels good. And then can you roll to the other side? And do the same. Okay, and that feels good as well. Now I'm just gonna get you to go onto your tummy. So roll onto your tummy. And I'm just gonna get you to raise this leg. Okay. And raise this leg. Okay, feels good. So you can flip back over. Now I'm just gonna inspect the hip joint for crepitus. So I'm just gonna raise the leg and while I palpate the joint, I feel no crepitus. So that's a normal finding as well. Okay, can you just sit up and swing your legs over the bed? Thank you. Okay, so I'm just gonna get you to try and put your leg out straight while I push down. Okay. And this one? Okay. So now I'm just gonna check the plantar and dorsal flexions. Okay, so plantar, dorsal, and dorsal. Okay, and that feels good. So that's all for our lower leg exam. We're gonna move back to the chair for our... Okay, so now I have my patient sitting back in the chair. We're gonna finish our exam with the upper extremities. So first thing I'm noticing just upon inspection is the skin integrity and tone. So it bilaterally looks the same, good skin integrity. There's no lesions, ecchymosis, edema, nothing abnormal. The hair looks distributed well and bilaterally looks the same. So first thing I'm gonna do is I'm just gonna check for muscle. So I noticed that the tone of the arms looks good and equal. So I'm just gonna get you to stick your hands out, palms up, and press up against mine. Okay, that was good. And then I'm just gonna get you to press down. Okay, that looks good. So now I'm just gonna check for temperature. So I'm gonna start up top and move my way down. And I notice that bilaterally feels the same. Perfect, and everything feels warm, not too hot, not too cool. So now I'm just gonna check for pulses. So first I'm gonna do my radial. Okay. And then I'm just gonna compare it to the other side. And I'm noticing that the rhythm is even. Also that the pulse feels strong and there's no abnormalities there. Now I'm gonna check for my brachial. Okay, I'm gonna compare it and I have the same findings there. Okay, now I'm just gonna check the joints on the hand. So there's no tenderness. Okay, and I feel no heat, no swelling, nothing abnormal there as well. Okay, I'm gonna compare to this side. There's no signs of arthritis, which would be swelling or pain or anything like that. Okay, and then I'm just gonna check the elbow joint as well, and that feels good as well. Okay, and then the last thing I'm going to check for on the upper extremities is the nails. So the nail bed looks good, the length looks appropriate, there's no discoloring. I'm going to press down the nail, it turns white, and the capillary refill is good. There's no clubbing visible. And just to double check the clubbing, I'm gonna get you to put your two nails together and then face up to me. Okay, and there's no diamond in between, which is a normal finding. Okay, so now we're gonna move on to our neurological portion of the exam. So, the first thing I'm gonna get you to do is a couple simple tests. So can you just put your palms upwards on your thighs and just put them over? And I'm just gonna get you to do that as fast as you can in both hands. Okay, looks good. Now on one hand, I'm just gonna get you to touch your forefinger to your thumb, then the next finger and the next, etc., and then go back. Okay, and can you do that on the other hand? Okay, looks good. So now we're gonna check our reflexes. So I would normally check my reflexes with a hammer, but because I don't have one today, we're just gonna simulate what I would do if I did have the hammer and what I would expect to find. So the first one I'm gonna do is on your arm. So I'm just gonna get you to rest your arm on mine, and I'm gonna landmark behind the bony prominence, just the tendon that's there. I would hit that and expect a reflex in either the thumb or the muscle. That would be my normal finding. I would repeat the same on the other arm. Then I would check my brachial, so doing the same, getting you to rest my arm. I just palpate in the space here, and I find that tendon, and then using indirect percussion, I hit my hammer, and I expect a muscle contraction of the arm towards this direction. Okay, so then I would do the same on the other side as well. My third place. So now I'm landmarking my third spot on the elbow. I'm just gonna landmark behind the elbow. I would hit my hammer and I would expect a reflex in this direction. Okay, so now next spot. I would normally have my bed raised, but if not, I'm just gonna grab under the patient's leg, get them to relax their leg, and then I'm just gonna landmark just below the patella and hit there, and I would expect a reflex in this direction, and the same on this side. My next one, so I'm just gonna take my patient's foot, just get them to relax their ankle, and then I'm gonna hit right here at the Achilles tendon, and I would expect a reflex there, and the same on this side. And then my last, on my plantar, I'm gonna go upwards in a J motion, and I would expect the toes to curl inward. I would expect the same on this side. Those are my reflexes. So then we're just gonna do some simple walking exercises. So I'm just gonna get you to stand. I'm gonna move the chair so we can see you walk. Okay. I see you right here. Right here. Okay. Just move the table out of the way too. Okay. So I'm just gonna get you to walk toward me. Okay. So normal even gait. Okay. You can turn around. So now I want you to walk heel to toe. So. Okay. I want you. Okay. Turn around. Okay. Place your heel in front of your toe. Yep. And then swing your other leg around. Yep. And just all the way towards me. Okay, and good balance there. You can do it. So you can turn around now. I want you to walk on your toes. So tippy toe. Yep. And turn around. And now I want you to walk on your heels. So, yep, perfect. Okay. So, that's the end of our exam. You can sit back down if you'd like. So do you have any further questions? So all my findings were within a normal range, so there's no worry here today. That would be the ending of my head to toe exam.